UTI stands for urinary tract infection. It tends to incorporate a number of different entities to include kidney infections, bladder infections, prostate infections. Those can be given other names, but they all have in common typically bacterial infection of the urinary tract. In men, urinary tract infections typically show up as prostatitis. That is, they feel they have to go to the bathroom more often. They're frequently voiding in small amounts. Sometimes they have to push to enable their bladder to get the urine past a swollen and therefore enlarged prostate gland. Sometimes there will be blood associated with that. Usually not, but sometimes there can be. Prostatitis in men should be treated initially with a month-long course of antibiotic therapy. The month-long course minimizes the risk of recurrence in the next 6 to 12 months. Urinary tract infections in men, the vast majority of the time, are of unknown cause. Urinary tract infection is not a sexually transmitted disease in either men or women. Urinary tract infections in women are far more common than they are in men and have far greater not only prevalence but recurrence rates in women as well. There are a number of things that women can do to avoid urinary tract infections. 4 things that I always cover with women. Number 1 is after they go to the bathroom, they should wipe from front to back, not back to front, because that brings contaminants, normal bacterial flora from the vagina onto the urethra, which can put them at risk for infection. Second is their underclothes should be cotton through the crotch area. Third, they should empty their bladder shortly after sex, certainly before going to sleep for the night. And some women are set up for urinary tract infections if they take baths, particularly with additives in the water, compared to taking showers. That said, there are some women who just are prone to urinary tract infections. And there are a number of ways to handle those. For an isolated infection or two every year, routine antibiotics when you have symptoms are most appropriate. Some women require suppressive antibiotics for 3 months or more at a time, where they take an antibiotic pill each night before bedtime in order to establish a sterilized bladder that does not have any bacteria, and then they go on from there to have a more normal pattern without recurring infections. A few other things to note about urinary tract infections in women particularly is they can progress to what's called pyelonephritis, or kidney infection, with some speed. Bladder infections tend to present lower tract irritative symptoms, burning with urination, going frequently, small volumes with each urination. Kidney infections are typically distinguished with the hallmark fever, chills, and flank pain. That presents a greater challenge. It's a more serious illness and needs prompter attention than a nuisance type of urinary tract infection affecting only the bladder. Additionally, bladder infection can also show up with hematuria, that is blood in the urine, that can be seen, usually caused by the infection, but sorting out whether it's caused by the infection or some other cause is the job of a urologist.